Loved Stephanie's video. I love Stephanie. She's been on the podcast. A couple of things. Yes, birth trauma can happen even if you have a completely normal birth. So often as a healthcare provider, I think you're only going to have birth trauma if you are like intubated and I'm doing CPR compressions on you, right? But there are a lot of things in birth, just because we're not ready for it in general society. We don't know how birth happens, that surprise people, catches them off guard, and then they have birth trauma, which is why I recommend people take a prenatal class, because I think it is so important and can help us not have birth trauma and carry that around. Another tip for you is if you feel like something's snagging at your brain, right? You're like constantly like, why did that happen? When did it ended up happening there? If you think of it, right after you have the baby, especially in that golden hour where the nurse is like cleaning up the room, you're getting up to the restroom, there's a lot of time that you could talk. Ask your nurse those questions. Hey, why did this happen? What caused this to happen? Things like that. And then your nurse can quickly explain it to you. And a lot of times those nagging feelings will leave because you understand it now. And a lot of times when we hear birth trauma, I will say as a healthcare worker, we immediately feel blamed. Like it's our fault that you have birth trauma. But like I mentioned before, a lot of it is just due to birth. It's not really anybody's fault. It's just how birth is. And so if we're able to explain it and keep you from having those nagging feelings, we would love to do it. So if you're in a room right after you have your baby, ask it. If you're in postpartum, ask. They can grab a labor nurse if they don't know. Sometimes your nurse will be back on and then they can easily explain it, or another nurse can just kind of explain why it usually happens, and it can really stop those nagging feelings that you might end up having and stop birth trauma in its tracks. Take a prenatal class. Studies show that it really leads to better birth outcomes. Not only less birth trauma, but also less C-sections, because you understand why things are going on. You're able to communicate better. Take a birth class. It can really help.